All right, get ready because today we're going deep on something that's actually a lot more complicated than you might think. Stopping psychiatric meds.
Yeah, it's not as easy as people think.
No, not at all. It's not just like, oh, I don't need this anymore. I'm just going to chuck it. Like there's a whole process, right?
Yeah.
And some of what we found in these sources is honestly pretty amazing to me.
Yeah, it's interesting. People know that starting these medications is something you have to be careful about.
Right.
But people don't think as much about stopping
Yeah.
and why that's a problem and how to do it safely. We're going to get into that.
It's not like yanking a plant out of the ground, right?
Right.
You can't just do that.
That's a great analogy.
These meds become part of your system.
Yeah, and the sources really emphasize that just suddenly stopping certain medications, it can have serious consequences.
Yeah.
Seizures from stopping benzodiazepines or wild mood swings after stopping lithium. You don't want to mess around with this stuff.
Yeah, no kidding. So what's the golden rule? Like, what's the first thing someone needs to know if they're thinking about stopping one of these medications?
Gradual tapering, all the sources talk about it. It's super important. Think of it like easing off the gas instead of slamming on the brakes.
Right. Okay, so that makes sense. But what's actually happening in the brain when you just suddenly stop a medication?
Well, imagine your brain is like a finely tuned orchestra, and each medication is like an instrument playing a specific part.
Okay.
When you suddenly take away that instrument, the whole orchestra goes out of tune.
Right.
There's this dissonance, and that's what we feel as withdrawal symptoms.
So it's not just about avoiding the discomfort.
Right.
It's actually about your brain going haywire.
Exactly. The sources go beyond general warnings, though. They talk about specifics of what can go wrong with different types of medications. For example, they talk about this thing called medication unresponsiveness.
Medication unresponsiveness. That sounds like a sci-fi thing.
Yeah.
What is that?
It's a real concern. There's research about it. It means if someone stops a medication and later needs to go back on it, it might not work as well the second time.
So wait, you're saying stopping and restarting a medication can actually make it less effective, like long-term. Why?
There are some theories, but one that came up in the sources is that there are neurophysiological changes that happen in the brain with every episode of a mental health condition.
Oh,
Think about it like a path in the woods.
okay.
The more you walk down that path, the more defined it becomes.
So each episode of, say, depression or anxiety is kind of deepening that neural pathway.
Right. Medications can kind of shift those pathways temporarily, but when you take them away, the brain goes back to those old patterns, and sometimes those patterns have become even more set.
Wow, that's fascinating, but also kind of scary. So if someone is thinking about stopping a medication, they really need to think about the long-term effects. It's not just a temporary decision.
Exactly. And that's why it's so important to talk openly and honestly with your doctor.
Right.
They can help you weigh the risks and benefits and come up with a plan that minimizes the chances of problems in the long run.
Okay, so let's talk more about that tapering process. You mentioned it before, but I'm curious about specifics. Like, how slow are we talking about? How do you know when you've tapered down enough?
The sources give some specific examples. For instance, with antidepressants like citalopram, it's also known as Celexa, they often reduce the dose by 25% to 50% each month. But it's not always the same for everyone.
So if I was taking, say, 40 milligrams of citalopram, I might go to 20 milligrams for a month, and then 10 milligrams for a month, and then stop.
That's the general idea, but again, it's super important to talk to your doctor because they'll take into account your specific situation and adjust things as needed. And it's not just about the percentage, it's also about how often you make those reductions.
Right, because some people are more sensitive to those dosage changes than others. What happens if you taper too quickly? What kinds of withdrawal symptoms should people be prepared for?
The sources actually break that down by different types of medications. For example, with heterocyclic antidepressants, those are an older type of antidepressants, you might see things like dizziness, nausea, or problems sleeping.
Okay, so not fun, but manageable. What about the newer antidepressants, the SSRIs and SNRIs? Those are really popular right now.
With those, you might get anxiety, tremors, or even these weird feelings people describe as electric shocks.
Wait, electric shocks, really?
Yeah.
That sounds kind of scary.
It can be pretty alarming, especially with the shorter acting versions of these medications. The half-life, the time it takes for half the dose to leave your system, makes a big difference in how intense those withdrawal symptoms are.
So the shorter the half-life, the more abrupt those changes are in the brain.
Exactly. And that's why your doctor might switch you to a longer acting medication to taper you off, even if you were originally on a shorter acting one.
Oh, okay.
It's all about making that transition as smooth as possible.
This is really making me realize just how much goes into these decisions. It's definitely not something you should just do on your own.
You got it. And honestly, we've only scratched the surface here. There are so many details depending on the specific medication, the person's history, and their overall health.
We'll be back in a bit to dig deeper into this whole thing about discontinuing medication.
Welcome back. Before we get into specific medications, I remember you mentioning earlier that Even lowering the dose can cause problems.
Yeah, that really surprised me. Like, it seems weird that just taking less of something could cause withdrawal.
You'd think so, right? But it all goes back to how sensitive our brains are to changes in these chemicals. Even a small change can throw things off.
So it's not just about stopping completely. Any change in your meds has to be done carefully with your doctor.
Exactly. And this is especially important with medications for sleep problems, like hypnotics.
Oh yeah, those are tricky to stop, right?
Yeah. Hypnotics, especially benzodiazepines and the newer non-benzodiazepines like zolpidem or escitalopram, they can be more habit-forming than other psychiatric medications.
So they're supposed to help you sleep, but they can actually make sleep problems worse in the long run.
Yeah, it's kind of ironic. One of the most common withdrawal symptoms is something called rebound insomnia.
Rebound insomnia.
So imagine you had trouble sleeping before, and then it's even harder to sleep after stopping the medication.
Oh, that sounds awful. Is there anything you can do about those rebound symptoms?
Sure, sometimes doctors will prescribe a different medication, maybe a sedating antidepressant like trazodone, to help while you're tapering off the hypnotic.
So it's like a temporary thing to help your brain readjust to sleeping without the hypnotic.
Exactly. It's all about minimizing the discomfort, making the transition smooth. And speaking of transitions, mood stabilizers can also be tough to taper off of.
Yeah, because those are the medications that help with those really intense mood swings, so coming off them too quickly could be a problem.
For sure. The sources are very clear about that. Suddenly stopping any mood stabilizer, whether it's lithium, an anticonvulsant, or a second-generation antipsychotic, can cause a manic episode or really bad mood swings.
So similar to antidepressants, it's all about going slow and steady.
Exactly. But there are some differences depending on the type of mood stabilizer. For example, with lithium, stopping it might not just bring back manic symptoms, but also cause a relapse of the original mood disorder, whether that was depression or bipolar disorder.
Oh, I see. So even if you feel okay, going off lithium without careful monitoring could make things a lot worse.
Exactly. Then there are the anticonvulsant mood stabilizers. They were originally developed to treat seizures, but they also work for certain mood disorders.
Right, I've heard of those. What are the risks with those?
The main worry is a rebound in seizures, especially for people with epilepsy. But even without a seizure disorder, stopping these meds suddenly can cause headaches, dizziness, shakiness. Just not fun.
Sounds like there's a pattern here. Whether it's antidepressants, hypnotics, or mood stabilizers, slow and steady is the way to go.
Absolutely. And that goes for the second-generation antipsychotics as well. These are usually used for things like schizophrenia and bipolar disorder, and stopping them suddenly can cause all sorts of problems.
Such as?
Well, you might see psychotic symptoms again, mood swings, or even something called withdrawal dyskinesias.
Withdrawal what now?
Dyskinesias. It's a fancy word for involuntary movements, like tics. They can affect your hands, limbs, face.
Oh, wow. I can see how that would be upsetting. Are those permanent?
Thankfully, they usually go away in a few weeks or months.
Okay.
But it's definitely something to watch out for. Another reason not to stop these medications abruptly.
So is there a rule of thumb for how slowly you taper off mood stabilizers? Or does it vary?
The sources suggest reducing the dose every 1 to 2 weeks, but that's assuming they're still being treated with another medication for their mood disorder.
Oh, so you wouldn't usually take someone off all their mood stabilizers at once?
Right. It's more common to adjust the dosages gradually, maybe even offset one medication with another during the tapering process, especially for people on multiple medications, what's called polypharmacy. It's like a carefully choreographed dance.
That makes sense. You wouldn't want to leave them completely unprotected while their brain is adjusting.
Exactly. Now, there's one more category we need to talk about, anti-anxiety medications, specifically benzodiazepines.
Oh yeah, those are the ones we mentioned before that could be risky to stop suddenly, right?
Yes. When it comes to benzodiazepines, gradual tapering is critical. This is serious stuff. Stopping too quickly can cause severe withdrawals, including seizures, which can even be life-threatening.
Okay, so how do you safely discontinue those?
The sources generally recommend reducing by about 10% each week, and often it helps to switch to a longer-acting benzodiazepine like clonazepam.
Wait, so you might actually switch to a different benzodiazepine while you're tapering. What?
It's all about keeping those brain chemicals from fluctuating too much. Longer-acting benzodiazepines provide a more stable level of the drug, which makes withdrawal less intense.
So it's about making the transition less bumpy. Are there any other things to consider with benzodiazepines?
Sometimes the dosage needs to be reduced so gradually that it's impossible to just break a pill into smaller pieces.
Oh, okay.
In those cases, you might need to dissolve the medication in liquid to get the dose exactly right. talk to your pharmacist about that.
Wow, this is really precise.
It is. And lastly, we have antipsychotics. They don't usually have the same withdrawal problems as benzodiazepines,
Okay.
but stopping them suddenly can still cause uncomfortable physical symptoms like stomach problems, dizziness, headaches, or insomnia.
So even if it's not as bad, it's still important to taper off. What's the main concern with stopping them too quickly?
The biggest worry is that psychotic symptoms will come back, especially in cases where the person might be a danger to themselves or others. So in those cases, dosage changes have to be slow and carefully monitored.
Right. You wouldn't want to put anyone at risk. But what happens if someone has to stop an antipsychotic suddenly because of a side effect? The sources mentioned something about clozapine and white blood cell count.
Right. Clozapine is a really effective antipsychotic, but it has a rare risk of causing a dangerous drop in white blood cell count, which you need to fight off infections. If that happens, the medication has to be stopped immediately.
So then you're dealing with a possibly life-threatening side effect and the risk of psychosis coming back.
Exactly. It's tricky. Usually they would start a different antipsychotic that doesn't have that same risk.
So you're weighing the benefits against the risks, trying to find the best option for that person.
Exactly. And that brings us to another important part of managing medications. Knowing the red flags that mean you need to go back to your doctor.
Okay, what are those red flags? When should you be worried?
One of the most common red flags is if the medication just isn't working. This means it's not doing a good job of controlling the symptoms. It might be time to change the dose, try a different medication, or look at other treatments.
So if you're not seeing any improvement, even after giving it a fair shot, you should talk to your doctor.
Right. And what's a fair shot can depend. First, you have to make sure the diagnosis is right. If you're treating the wrong condition, it's not going to work. Then there's whether the person is actually taking their medication as prescribed. It sounds basic, but it's important. And of course, the dose and how long they've been taking it matter a lot, too.
So you can't just expect a miracle cure from one pill.
Usually not. Most psychiatric medications take time to build up in your system and work. And the right dose is different for everyone. The goal is to find the lowest dose that works so you get the benefits without too many side effects.
It's about finding the right balance.
Yeah. And even if a medication worked before, you might need a dosage adjustment later. Our bodies change, our lives change, our needs change. The treatment has to change too.
Okay, so not responding to medication, needing a dosage change. What else are we looking for?
Relapses are a big one. If someone's symptoms come back after a period of stability, that means something needs to change. Maybe the medication isn't working anymore. Maybe there's a new stress in their life. Maybe the diagnosis needs to be reevaluated. Lots to think about.
Right, mental health isn't static. It's a journey. Speaking of which, what about changes in someone's overall health? Could that affect their meds?
Absolutely. The sources really emphasize that any changes in your overall health can affect how your body processes medication. New diagnoses, surgeries, even big lifestyle changes, let your doctor know.
It's like those warnings about drug interactions. But it's not just other drugs, it's your whole health picture.
Exactly. And then there are side effects. That's a major red flag if they become unbearable or start affecting your quality of life. What's the point of taking a medication if the side effects are making things worse? There might be other medications or dosage adjustments that can help. And if nothing else works, stopping the medication might be the best option, but again, only with your doctor's guidance.
Right, because as we've seen, messing with medication on your own is never a good idea. These medications affect your brain, and changing things without expert help can have bad consequences. It might be tempting to try to fix things yourself, but don't. Talk to your doctor.
Absolutely. Talk to your doctor. This has been a really interesting look into discontinuing medication. I feel like I understand a lot better how complex it is and how important it is to have an individualized approach. There's definitely no one-size-fits-all solution. What works for one person might not work for another, and it's not always a straight line.
You know, as we've been talking about all this, about the different medications and how to stop them, I keep thinking about something you said earlier, about how every time someone has a mental health episode, it kind of changes their brain a little bit.
Yeah, that's really important to remember. Our brains aren't just fixed. They're always changing based on what we go through, and that includes mental illness and the medications we take.
Right. It's like our brains have a memory for those emotional states.
I like that. And it helps explain why stopping medication can be hard. It's not like you just stop taking something and everything goes back to how it was before.
Right.
There might be these patterns, these pathways in the brain that have become really strong, and it's tough to change them.
So even if a medication helped, you can't just assume that stopping it will leave you exactly how you were before you started.
Exactly. And that's why you have to think of stopping medication as a process, not just an event. You have to work with your doctor, watch your symptoms, maybe adjust your treatment.
Right.
Make sure you're getting the support you need to handle those brain changes.
It's like a dance between your brain, your body, and the medication.
I like that. It really captures what this is all about. It's not about forcing your brain to do something. It's about listening to your body, understanding what you need and working with your doctor to find the right way forward.
And what works for one person might not work for another, and what worked for you before might not work now.
Exactly. As we finish up here, I want to leave everyone with this thought. When it comes to mental health, it's okay to ask for help, whether it's medication, therapy, lifestyle changes, or all of those things.
Right.
Reaching out for help is a good thing.
And remember, you're not alone. There are lots of resources out there, like support groups, online communities, and mental health professionals who want to help you feel better.
Yes, and we always encourage you to keep learning, asking questions, and not just accepting things without thinking. There's so much to learn about mental health, and the more we learn, the better we can take care of ourselves.
Well said. Thank you so much for joining us for this deep dive into stopping medication. We hope to learn something, thought about some things, and maybe even feel a bit more hopeful. Until next time, stay curious, stay informed, and most importantly, stay well.